All right, we're live.
Woohoo!
So let's wait for 15 people to come on before we officially begin. I see the counter starting already. For those of you who last weekend, I hope all of you had a long weekend last week. I definitely did. It was a good short break. And now this week we're back with Talking Life with Macy. Today will be a health topic. And actually, for the rest of the month of August, we're going to have a health series. So I definitely want you guys who are interested in health to stay tuned every weekend because we're actually going to have some doctors on board as well to answer some questions that you may have about health issues. So please come on every Sunday at 3:30 p.m. in the month of August if you are concerned about your health or if you have questions about health. So, for those of you who are new, welcome to Talking Life with Macy. And for those of you who join me every week, welcome back to Talking Life with Macy. Today, we have a very special guest with us. Before that, I would like to highlight today's topic. A lot of people talk about fertility and cancer, but always in a very hush hush manner because surprisingly it is a taboo topic in Malaysia, maybe in a lot of parts of Asia actually. But today we're going to address both of them together, fertility and cancer, two huge topics that is so taboo. And let me highlight and address a little bit about what young female cancer patients actually go through. So I think for those of you who are tuning in, you're female and you are young and you are a cancer patient, you totally get where I'm coming from. And we've more than achieved 15 people, so I will go straight to the topic. For us, young female cancer patients, when we go into a doctor's office after being diagnosed with cancer, I'll share with you my experience. I remember my doctor sitting me down and he asked me, are you married? This goes for female cancer patients from 25 to 35, the like fertile age they call it. And I was like, I actually started laughing. I was like, wait, why would you ask me whether I'm married or not? I was 27 and I was thinking, I haven't thought of that yet. I started laughing and I told my doctor that I was like, it hasn't come across my mind. And the funny thing was I was only dating Ben for about 2 years plus at that point of time. I'm sorry, Ben, but at that point of time I wasn't sure whether he was the one yet. I mean, it's just 2 years plus. We're still chasing our careers, right?
Yeah.
And then you have this doctor asking me whether I'm married. So I said, no, I'm not. And then he said, do you have plans to get married? I was like, I think we should ask Ben, right, about this. And then after that, the third question was, do you plan to have kids? Then I was like, I think at that point of time, I wasn't really sure where the questions were going towards until
Yeah.
the treatment plans come along. I think this goes for a lot of female cancer patients out there who are young. And I've spoken to a few of them, and they said that they were asked those questions as well.
Yeah.
And we find out because when you undergo chemotherapy and excessive radiotherapy in the regions near your uterus, the chances of you getting pregnant actually drops a lot. And that's why doctors actually come and ask you questions like that. And it became a topic, fertility became a topic that needs to be spoken and discussed with your doctor at the beginning of treatment for young female cancer patients. So it has for me. Like I said, I am 5 years plus cancer free. For Stacy, she's yet to achieve 5 years. And when this was what happened to her when she was diagnosed with cancer at 25, mind you, 25 years old. The doctor asked her whether she said when she was faced with death, the doctor asked her whether she was planning to get married. And she said the thought that crossed her mind was, I've done many things in my life till the age
Yeah.
I'm 25 now. But the only thing I haven't done is have children. That's what she told me, and I think that's what she's going to tell you. So that became her lifelong dream. She's a very ambitious person, by the way, guys, and she was really career oriented. And all of a sudden, her dream was to be a mom. So she said she really wanted RK to propose to her then at 25. RK had a lot of
Yeah.
pressure, I'm sure. and so that's her story. Let's talk more to her. I'm so happy she decided to come on board to share her story and be so open about fertility and cancer. So thanks a lot, Stacy, for joining us today.
No worries. Thank you so much for
Um,
having me. Yeah.
okay, so I'm just gonna go to the questions. How
Sure.
did you feel when you were first diagnosed with colorectal cancer?
Um, to put it very simply, I was very shocked. I was very overwhelmed. I think at that point in time, I was 25, as you were saying. It was a good time to chase after career. I didn't think so much about family planning and things like that. But suddenly to be hit by a disease that is typically at risk for people 50 and above, that was really scary and that was very overwhelming. There were a lot of things to process at that point. It was just like craziness.
Okay, so I think a lot of people would like to ask, how do you find out about it?
Yeah. So I would say that I found out about my stage 3 colorectal cancer by luck, actually. I would say by pure luck or maybe by accident. I'm not sure. Okay. So I just got into a job. I was 6 months into a new job. And as part of my confirmation process, my company required me to go for a pre employment medical checkup. Prior to the medical checkup, I actually had a pain at my lower abdomen and I felt a bulge at that time. So I went to a specialist to have it checked. And the specialist told me that she suspected that I was constipated. So she gave me constipation medicine and the pain actually went away after I took the constipation medicine. So I was like, okay, it's gone. It's not causing me any issue anymore. So I can get move on with life and forget about it. Until the pre-employment checkup, the doctor asked me whether or not anything happened, in the past 3 months related to your health and stuff like that. So I very casually just mentioned to him about my constipation episode, and he was like, "Oh, okay, you felt a bulge." I was like, "No more now. Can I just check?" So he did a physical examination. He just asked me to lie down on the bed, and then he just pressed around my abdomen area just to check whether or not there was anything wrong, just in case, right? And he felt something. He felt a mess at that point in time, and he wanted to be careful, so he asked me to proceed to meet a GI specialist, a gastroenterologist. I went. I didn't think so much about it actually, so I just went. The following weekend, and then my mom didn't even know about it, and ended up I had to go through a colonoscopy because the GI specialist also thought that he felt something and he was concerned. So they went through the ultrasound, and throughout the entire time, he was just like, I think you're constipated, but okay, we're already here. So then he did a colonoscopy anyway as a precaution, and that led to a CT scan within the same day. And that then led to 2 days later, he asked me to get back to the office. And at that point in time, when he saw the report, he was like, "Girl, you're in trouble. It's cancer." I was like, what just happened? I just wanted to confirm, my job. And from this I felt like very harmless, checkup suddenly turned into a cancer diagnosis, and my world just suddenly turned upside down. So there were so many things that was happening at that time. My mom didn't even know that I was going through any of these doctor visits, because I really thought that it was just nothing. So yeah, it was really crazy, the way that I found out. But I guess that I also felt really fortunate at that time that I met doctors who were extra careful with me, despite the fact that I was just too young. I was just too young, to suspect that this constipation issue is actually colorectal cancer.
Okay. So, yeah, for people who don't know, usually colorectal cancer happens to people above 50, and usually they are
Yeah.
males, unless you have genetic history of cancer. So, it is really rare. And yeah, Stacey is really lucky to have a good panel of doctors. So, my next question is, what was your biggest worry about having cancer? I think
The
this is a good
first
time to share the story.
Yes, I think the first, definitely, I'll be very honest. The first worry that I had was financial. The minute I came out from the doctor's office, I was alone at that time. So the first person I contacted was my insurance agent. So I just called her. I was like, okay, I had this problem. am I covered? Then she was like, yes. Then only I went on to think about who I should inform next and stuff like that. And everything else, honestly, everything else, every other issue that I faced during the entire cancer journey, I learned it along the way. I didn't know that a lot of things, I didn't know that it would be a concern. It was something that I need to think about until, as it developed. So I would say that it was kind of like a on the job training. And one of the things that I discovered that I had to worry about was definitely fertility, specifically infertility risk. At that point in time when I got diagnosed, right, within the same day I met the surgeon. Within like a few hours I met the surgeon, and immediately he scheduled for a surgery the following week. So within that 1 week, there were so many things that I had to learn. I was like, what do you mean by, there's a 5% risk that I may come out with an ostomy bag? Like, what is the ostomy bag? And they were like, you're on liquid diet. What liquid diet? What are you talking about? And cancer is like a whole new world that suddenly opened up to me, and I just had so many things that I needed to pick up, and also a lot of things that I needed to sort out in terms of my personal life, like figuring out how to tell my mom, and then figure out how to hand over work, and whether or not, like, is this for real? At the same time, I had to process, right? Is this for real? There were so many things that was happening. So from that time, within that 1 week, there were so many things that I had to do. And after I broke the news to my mom, and she found out that I was going to go through an open abdomen surgery within a week, her first concern was, of course, there was so many things that she wanted to catch up on, right? And her first concern was that, who is going to operate on you? Who is this doctor? I need to meet this doctor that is going to cut my daughter open. So very valid. So what we did was, I brought her along together with my boyfriend at that time to the doctor's clinic. So we just walked in, and then we just said that, my mom is just concerned. My mom just want to see you and know that, you're a good person. You're going to take care of me. It was more like a meet and greet session. There wasn't any agenda per se, but it was more to just reassure my mom. And at that point in time, because my then boyfriend was also in the room, so the doctor started with his question. So he's like, oh, who is this? I was like, oh, my boyfriend. I was like, so you guys are not married yet? I was like, no. Do you plan? No. It was quite funny. He actually turned to my then boyfriend and asked whether or not he was serious about the relationship, whether or not he was planning to marry me. And then after he turned to me, and then he was like asking, am I allowed to discuss this topic in front of him? At that point in time, I was very much like you. I was like, what you want to talk about? Like, why are you asking these kind of questions? And then he proceeded and said that cancer treatment comes with risk to infertility. And if you're planning to have kids, that is definitely something that we have to discuss and talk about. But the way the entire conversation started, I was definitely caught very off guard. And he mentioned also to me during that same meeting that typically he will recommend and advise his young cancer patients, especially the female ones, to do fertility preservation first. Meaning maybe to take out the eggs first before going through surgery, just in case, right? But for my case, he didn't offer me that option from the start. Reason being because he needed to operate me already. He said that he only could give me maximum of 1 week to have this surgery done because my bowel was already almost blocked. I think I was already 80% blocked. So if it were to get blocked anymore, I have to go through emergency surgery, and that would be a lot more riskier and a lot crazier. So at that point in time, I was just stunned. I was like, I came here for a meet and greet, and suddenly you start asking me whether or not I plan to have kids, and then you suddenly tell me that what? That's not even the only question that I have to think about. I have to also think about whether or not I can have kids if I were to survive this entire ordeal. That was really scary. That was really scary. Yeah.
Okay, so then your dream was to start a family after that meet and greet session, especially after you met him. So are you now achieving it? Has that journey, that fertility journey been difficult, having had cancer and to get pregnant?
Yeah. So I guess spoiler alert first. thankfully, it is a happy ending now. I am 4.5 months pregnant, which is also a reason why it is easier to talk about it now for me. I know that a lot of people, if you would have asked me this before I got pregnant, I don't think I'm going to talk about it in public because it's just such a sensitive and also difficult topic for so many. And I have to say, yes, it was very difficult going through this entire issue. Cancer alone was already very stressful. And at this day and age, infertility is a very common problem. That is also, that is also really difficult. So when you have these two combined together, and the fact that you have to try to balance between preserving our lives and preserving our fertility, I think that gets really overwhelming. And for me, I thought about this question a lot before our conversation today. And I think there were a few factors that make it so challenging. I think firstly is because family planning is not just my business. It is also something that is of concern to my, at that time was like future husband, and also our families. So family planning. So suddenly, cancer treatment is not just about saving my life, but it's also whether or not I'm keeping the chance of expanding the family for these few other people that matter. So it's not just about me anymore, when I choose cancer treatment options. So secondly, I think what was really difficult was the fact that cancer and infertility on their own is something that is not within control. But cancer treatment and also fertility preservation are within my control. So when I signed out for the surgery, I knew that I was allowing my surgeon to cut me open and remove the tumor pretty much almost at any cost, right? If he were to see that, okay, number one, of course, he has to remove the tumor, he has to remove part of my colon. And if there is any other organ, including reproductive organ, that was inflicted by this tumor, by this cancer, he will have to make that decision. I will be like zonk out, right? So he will have to make that decision whether or not, he would have to risk my other organs as well. So when I signed up for that surgery, I knew that I was signing up for this risk as well. Okay. Secondly, when I allowed my oncologist to inject 12 cycles of chemotherapy drug into my body, I knew that it will also impact my fertility to a certain extent. To what extent, none of us would know. But I knew that I was taking that risk. And at that point in time, I chose to still proceed with it, even though actually at that point in time, there was already no evidence of cancer. But I still took that risk. And thirdly, after the entire treatment and stuff like that, I actually signed up for a clinical trial that lasted for 3 years. So I had to take a drug for 3 years. And I knew that if I were to fall pregnant during the clinical trial, I will be dropped out from the program. And if that were to happen, who knows, maybe this clinical trial would have saved my life, lowered my chance of recurrence many years down the road. But I never know. So it was also another decision whether or not I want to commit to these 3 years or how. But ultimately, I decided to commit to it for at least 2 years. But eventually I actually managed to finish it because I didn't fall pregnant during that 3 years. Yeah. So these were all the burdens of the choices that I made and the risks that I took, which I guess is also the reason why I feel extra burdened and also extra stressed up about all of this, right? And last but not least, I think one thing that is very mysterious for a lot of us young cancer survivors is that at a point in time when I had to make all of these decisions, right, about preserving my fertility or about the risk of infertility that I have to go through, I don't even know whether or not I'm fertile. I don't know my fertility rate because I've never tried, getting pregnant, conceiving at the age of 25 before. Oh, did Maisie just disappear? Hey, Maisie. Hey. Hello. Am I still online? Sorry, guys. I cannot see your comment.
Hello?
Maisie, are you still there?
Sorry, can you guys
Okay, it disappeared again.
Hello, can you guys see us? Hello, can you hear me?
I can hear you. Yes.
Is it because you were lagging for a bit? Sorry.
Oh no.
Hello? Okay, now it's okay.
Now it's okay. All right. Where was I?
Yeah.
Okay. So I was saying that at a point in time when I was put into this position to make so many decisions about preserving my life versus preserving my fertility, I didn't even know how fertile I was. I didn't know whether or not, I was very fertile, not so fertile, normal fertile, or like totally infertile, right? But I was already having to make all of these decisions and take the risk, not knowing where I even start from, like where, how fertile I am, and whether or not the risk is too much or too little. I guess those were the things that was really scary. And unfortunately, I believe that it is also it's such a sensitive and difficult topic for so many, but it's also so common for so many of Earth's young cancer survivors, especially the females one.
Okay. All right. So, like, I understood like where when you spoke about your entire treatment process, your journey
Mm,
to being, to having a child. It's so painful. I think for many of us, even for I think when I have my next guest on the show, Alina, I think for you as well, I think for many of us out there, fertility was not a question that was something that we thought of when we were in our
mm,
20s, because I think we were still chasing our careers. But now it
yeah,
has become the forefront. It becomes the forefront of our treatment plan, our diagnosis when we are first diagnosed with cancer. And it's not difficult for Stacy. I mean, it's not easy for Stacy, nor for me, or for any of the young female cancer patients out there and survivors. So,
yeah.
thank you for making such informed decisions, for sharing it with us. And I'm so happy that you're pregnant. Congratulations.
Thank
I think
you.
that is such a huge thing. When you messaged me and told me you were pregnant, I was
Yeah,
like, oh my gosh, you're so lucky. And
yeah.
congratulations, RK, and to the Lee family. I
Thank
just
you.
feel that I mean, although we say it, but the
Mm,
burden of having a child, in a way, the responsibility falls on us because we also want to, no, I mean, not just for ourselves, but like you said, for the people around us that want to have
yeah.
kids. So yeah, this is such a huge topic, and especially having to deal with both cancer and dealing with uh, having a child as well. I
Yeah.
cannot. I resonate with you on this.
Yeah.
So I have to ask, since getting pregnant, has there
Mm.
been any complications?
Yes, and I will focus on complication related to the cancer treatment itself. Actually, this was also another like on the job training kind of thingy. I didn't think so much about it. I was just so focused on, oh, okay, am I fertile? If I can, when we try to conceive, and if I can conceive, just be happy. I didn't think so much about it until actually my boss, when he heard about my story about the fact that I'm a cancer survivor, and then he found out that I'm pregnant, and then he was like, "What are you doing to your body?" And at that point in time, I'm like, "What are you talking about?" It's like, "Why are you talking about this good news?" I just want to celebrate, and that's it. But later on along the way, I did find out that there are complications that can come out because of the cancer treatment that I went through. So one of it being because I had an open surgery, a 5.5-inch long abdomen scar across my abdomen. So there, for somebody who could go through a surgery like that, scarring tissue is very common. So what happened to me was that up until actually just a couple of weeks ago, I was suffering from this addition colic pain as a result of that surgery. So the pain was persistent for about 2.5 weeks. So it was so difficult to like move. It was so painful to move around, to walk, and especially after meals, because the addition colic was very likely at my small intestine. So after I eat, then I'll feel super bloated, and then I'll feel the pain, and the pain can sometimes get really unbearable as well. But the good news about the addition colic pain is that if it stays as a localized pain, then there's no harm to the pregnancy. You just have to deal with the pain, with or without painkiller. That's up to you. But the scary news is that there is also a risk of additional colic pain leading to a bowel obstruction. So if there is a bowel obstruction, it will mean that I have to go into the emergency, and that the doctors will have to cut me open even though I'm pregnant to release the bowel obstruction. So that was really scary. And of course, I'm just super thankful that the pain has gone away now, and that hopefully it doesn't visit me anymore. I'm also very thankful that, I guess also very surprised at the same time as well that 4 years after my surgery, that things like this can still happen, because I've never felt any additional colic pain since my surgery 4 years ago. But because of the pregnancy, because of the changes to our body, I believe that, the womb is expanding and is pushing the other organs around. And that's when the scarring tissue started to cause problem. And that's when then I discovered that things like this can happen. And it has just been there. It's just never been triggered. So the baby has kind of triggered it.
Oh
Yeah.
my gosh, now I'm a bit worried about that. But just FYI, because Stacy was also texting me about this adhesion colic pain.
Yep.
The pain was so painful. She was saying it was 7 out of 10 in terms of pain level. I mean, for cancer patients, you guys know what that means. 7 out of 10, it's extremely painful. She says sometimes it could go up to 8 out of 10. I was like, oh my goodness. So if I don't know how you took it for 4.5 months, 7 to
Four
eight
and a
out of
half weeks. 4.5 weeks. The
Oh,
pain was there for four and a
yeah,
half weeks.
but that's
Yeah.
still like so long. Like that's one month plus of
Yeah, 1 month.
pain of 7 to 8 out of 10 every day. I mean,
It
oh my
normally offers,
goodness.
I mean, I don't want to make it sound too bad, but it's not 7 out of 10 all the time. It normally gets worse towards the night or when I eat a lot. And the problem is that I'm supposed to gain weight as well, but then after I eat, then I get this pain. So it's like definitely a struggle. Yeah, but I just kind of, during that time, I just learned how to manage it. So I tend to just try to press on the localized area to suppress the pain. Try not to even open heavy door, because I just don't have the energy to really open heavy doors actually. Yeah, and when I walk, I'll be holding my stomach as if I'm like really pregnant, but I was like, I mean, heavily pregnant, but that was like during the first trimester. So that was really weird. Yeah, I felt like it was kind of like over the top that I was holding my stomach all the time during the first trimester.
It's
Yeah, and
okay.
I just have to manage and make sure I don't sneeze, because that's really painful when I sneeze. Yeah,
Okay. I'm glad it's not visiting you anymore.
hopefully,
So
fingers crossed.
how does it feel to be seeing your dream come to life?
Relief beyond belief. It felt like, yeah, it felt like, I finally got an answer to a bet that I made on my own health 4 years ago. It felt that I finally got a positive test result for an exam that I took like 4 years ago. That this 4 years has just been so mysterious and just so scary, and sometimes it can get really overwhelming when you start thinking about it. But I'm just so glad that and to very happy to finally know that my body is capable of creating a new life, and I can only hope and pray that my body is also capable of sustaining this life until full term. Yeah.
Amazing. Like it's amazing how our bodies are in a way.
Yeah.
For someone who has gone through both radiotherapy and chemotherapy, and yet going through 7 out of 10 pain and having a baby now 4.5 months, that's really something. And
Yeah, but by the way, correction, I did surgery and chemotherapy. There was no radiation.
oh, you didn't do radio. Okay, so
No, I didn't do radio.
mostly chemotherapy, but 12 cycles is a lot, by the way. So, what is your advice for those who have had cancer and want to have a family too?
First of all, talk to your doctor before treatment. I guess speaking to a couple of cancer survivors, young cancer survivors, I guess we can relate and we realize that not every doctor will have this conversation with you before the treatment started. Like even for me, the conversation came out very impromptu, and I was definitely caught off guard by that. So it will be great, if at least the doctor can bring us through this entire day, hopefully help us to process, help us to access what is our infertility risk in regard to each of the treatments. But very importantly, I guess, first of all, we'll definitely have to talk about it first with the doctor. And secondly, also, I guess that even if let's just say that we have already gone through treatment, unfortunately, if those who have already gone through treatment but didn't manage to have this conversation with the doctor then, I think it's still very important to have the conversation with the doctor now, to access and understand what are your fertility options. Because
Yeah.
hopefully it's not too late, at least there are things that we can control, which is, I mean, at least just try to find out and understand the situation better. So to just do more homework and to know what are the things that we can control and what are the things that we cannot control, then too bad we have to let go. But for things that we have to control, then we will have to do our best to do it. And also you have to understand what your priorities are in terms of family planning as well. A lot of us didn't start thinking until the questions came to us from by the doctors. But I guess start thinking about it as well. If very unfortunately you already diagnosed with cancer, if what is your priority when it comes to family planning? If natural conception is very important to you, I definitely say try to start as soon as you can, because you really don't know how fertile you are to start with in the first place, right? And if let's just say that I guess fertility treatment is an option for you, I don't know, start saving because it's really expensive, right? Having to go
Yeah.
through,
Yes.
and it's also very difficult on your body and stuff like that. So definitely requires a lot of planning, especially after going through, cancer treatment. Then if you have to go through fertility treatment as well, it's definitely going to take a lot from the body. And if let's just say that natural, like biological family planning is is also something that you consider, I guess it's great as well. I mean, like you do you. We already went through so many things. I think that we don't need validation from other people to decide what type of family planning that we want, or what type of fertility prevention or preservation that we want. So yeah, I guess just have to ask yourself what's important and then make it known to people who matter and just go for it.
I completely agree with you when it comes to this because like I mean although my doctors asked me whether I was married at a point of time, which I said no, then they I think they had a discussion amongst themselves. So all my doctors actually had this rumor going about that my apparently my dad told them I was going to be married soon, and I was like, okay, I don't know where they got that from. So marriage was definitely on the cards, and they were trying to rush my treatment so I could get married, apparently, but I wasn't even proposed to at that point of time yet. Um, I completely I so agree with you. I think Alina, I think people who are watching also agree with you. For those of you who have gone through cancer treatment, that is already one tough journey.
Yeah.
For those of you who have gone through chemotherapy, radiotherapy, and even surgeries, um, that is one hurdle that you've been through. So for those of you who are female and I mean, you do want to have kids, I think fertility is such a huge topic that you definitely need to discuss with your doctors and do it as soon as possible. Start planning now. I wish my doctors told me earlier. I mean, my gynae, maybe because my gynae wasn't my consulting gynae when I had cancer. So that was an issue. I will be discussing this topic further, maybe in the future, but
Mhm.
this is something that I
Yeah.
feel for all of you who are experiencing cancer now. Speak to your doctors about fertility if you want to preserve your eggs,
Yeah.
and if you want to have kids. I think please do so. It's very very important. And
Yeah.
for both of us, for both Stacey and I think we both wanted to, we talked about this and we want to start a family, but her more so. I mean, she said she completely changed from being so ambitious about a career to being ambitious about having a child.
Yeah.
So she was like, I wish, I mean, like, when is RK going to propose? I remember she was like asking me that, and thank God RK proposed, and now they have a kid. I mean, they're going to have a kid. So congratulations once again, Stacy. Now, I think for those of you who are watching, who have been watching since like the beginning of today's
Mm.
session, do you have questions for Stacy or for myself about cancer or fertility, please go ahead and ask us. I think Stacy is here right now, so it'll be a good time to ask her any questions that you may have. She shared a lot about what she went through. I think she's really strong from the first day I met her till now. We'll give you guys like a few, like maybe 2 or 3 minutes. If you have questions, please keep them coming so we can address them now. And as like I said, Stacy is here to address them.
Yeah. That non-medical question, please.
Yeah, I mean, preferably non-medical questions, but if you have question about her journey, about diagnosis, about fertility, her experience with cancer, things like that, please go ahead and ask her.
Yeah.
I think everyone who's staying tuned, I think we're all really happy for you, and
Thank
and
you.
and your story is really inspiring, and I think a lot of people can have really good takeaways from this, especially the female cancer patients who are watching this.
Yeah. And I guess also I want to give a few shout outs to, there are a couple of young cancer survivors within our circle of support group that managed to get pregnant, through natural conception, some through assisted conception. But so hope is not lost. And I guess I also want to top up to say that it's not just something that can happen to female cancer survivors, but male as well. But I'm also aware of male cancer survivors who went through radiotherapy, especially for like rectal cancer, who were then told that he will be infertile, but now he has like a 7-year-old daughter. Yeah, so it's sometimes miracles to happen. So I guess we have to have faith, and hopefully cases like this will give us more hope to persevere.
Yeah, that's true. Your case will definitely give a lot of people hope too. So Mr.
Thank
Chong
you.
said no questions, but he really salutes your courage and all the best.
Thank
Um,
you.
yeah, I think a lot of people says, I mean, congratulates you, and everyone here is like rooting for you. So
Thank you so
we
much.
um, and for those of you who like to watch these health sessions, we're going to have more cancer survivors on board to talk about their experiences, to share more. I'm planning to bring on Alina as well. She's a two-time cancer survivor. She has had ovarian cancer at the age of 12 and also thyroid cancer at the age of 16. Amazing girl. So I plan to have her on to talk about her journey in the next couple of weeks. So please stay tuned. If you have questions, DM me on Facebook or on Instagram. And if you want to watch this video on YouTube, you can as well. Stacey, do you have any last words for everyone here before we close the session?
Have faith. Have faith, and hopefully, I pray that everybody who is trying, who has this concern, I pray that there will be a happy ending and good ending for everyone as well. So let's have faith together.
Thank you. Thanks, Stacey, for joining us today. And thank you all for watching. If you think this would benefit someone, inspire someone, please share it with them about fertility and cancer. Thank you, guys.
Thank you
Bye.
so much. Enjoy your
Thank
Sunday. Bye.
you. Bye.